Patricia is 56 years old, and she came to see me because she'd suffered a relatively minor fall that had resulted in quite a severe and complicated wrist fracture. At the age of 56, it's very rare for somebody to trip, fall, and break their wrist in a very nasty way. But she'd ended up having to have surgery, plates and screws, to fix the severe fracture that she'd suffered. When she'd seen her orthopedic surgeon around 4 weeks after the surgery, he'd voiced concern that her bones were not healing properly. He said to her that it was taking much longer for him to see healing on her bones than he'd expected. But he didn't offer her any advice on how to improve her healing. He just said to her, "Come and see me again in 2 months' time and we'll see how your bones are doing." Now, unfortunately, I see this kind of problem quite frequently, where the specialists deal with the problem in front of them. They see a broken bone, they fix the broken bone, but they don't look at the entire context, and they don't treat their patient as a whole, complex human being. So Patricia came to see me for advice on how to improve her bone health and how to heal faster. Now, the first thing I needed to do was to establish why she was not healing properly. When I looked at Patricia, I could see that she was tall, slim, and fair. She said she'd always been a very slim person. And she mentioned that her mother had had osteoporosis and was suffering terribly in her old age from severe back pain and immobility as a result of horrible bone density. Patricia was 56, so she was well within menopause, and nobody up until this point had ever discussed bone density with her. So I said to her, "Please go and have a bone density assessment done." She came back to me with the results, and it confirmed that she was well within the range of osteoporosis. So at the age of 56, to have osteoporosis already, that puts you at very high risk of suffering more fractures later on in life. It was really important that we institute a plan of action to improve Patricia's bone density and to get her healing well from the fracture, but also to prevent her from having complications of osteoporosis in the long term. Now, osteoporosis is potentially reversible. You can improve your bone density over time with lifestyle interventions. So what I explained to Patricia is that we needed to modify her diet. We needed to institute an exercise program that was targeted to improving bone density, and we needed to treat with specific supplements that would help to improve her bone health. I advised her to eat a lot of protein-based foods. I advised her to eat foods that were very rich in the minerals necessary to help bones mineralize. So fish that contain bones, an excellent source of calcium, magnesium, zinc, phosphate. Bone broth, absolutely fantastic. Bone broth is made from bones, so you are providing the body with those raw materials, as well as leafy greens, nuts and seeds, and grains that are also very rich in those micronutrients that your bones need. I asked Patricia to supplement with calcium, magnesium, zinc, as well as vitamin D. Very, very important, because the function of vitamin D is to take the calcium out of the bloodstream and push it into the bones so that the bones become stronger and have better integrity. I also asked Patricia to include an exercise program specific for bone health. This involves strength training, where you stress the bones by activating the muscles attaching to those bones, as well as impact exercise, things like light jogging or walking with a backpack or extra weight, skipping, dancing, aerobics, anything where there is some degree of impact that stresses the bones. With all of these recommended interventions, I asked Patricia to repeat her x-rays about 4 weeks after she'd initially come to see me, not to wait the full 8 weeks that her orthopedic surgeon had recommended. And fortunately, after that first month, we did see some significant improvement in the healing and the callus formation of her bone. So we knew that we were on the right path. But I also asked her to repeat her bone density scan after 18 months. Bone is quite a slow growing organ, so you have to give it time to improve. And what was wonderful was that after 18 months purely of lifestyle intervention and supplementation, all natural therapy, Patricia's bone density improved significantly. She was no longer in the osteoporosis range, but we managed to get her into the osteopenic range. Her bone density was still lower than optimal for her age, but she was not at high risk of suffering a complicated fracture, and her risk long-term of having complications from osteoporosis was significantly lower. So this case illustrates that if you optimize your lifestyle factors that are contributing to low bone density, you can improve your bone density significantly without relying on medications. So osteoporosis is a disease that we can treat with lifestyle or behavior intervention.